will take us further in achieving universal health coverage. Let's start from the ground up, understand what happens at the training level, and discuss the state of healthcare in Kenya, including welfare of the health workforce. Now, here's an interesting fact. Did you know that 85% of the local health sector workforce are actually graduates or trainees of the Kenya Medical Training College? That literally means that you cannot miss one or two health professionals that have passed through the hands of KMTC. Who better to tell us more than the CEO of the Kenya Medical Training College, Professor Michael Kiptoo. Welcome to the show.
Thank you very much.
We're very happy to have you here today. You know, when I was actually looking at your profile as KMTC, reading more about you, you know, you really do stress on middle-level health professionals, and, you know, those are bulk of the people who pass through your hands. Why don't you start off by explaining which group this is and the vital role that they play in healthcare today?
Thank you very much. I think before, just to give a quick background on KMTC.
Yeah.
KMTC is one of the oldest institutions that we have in this country. It was established in 1927, so we have basically been training for the last 93 years. We train mid-level health workforce for this country and beyond. When you look at these mid-level trainees or graduates, these are the ones who actually do a lot of work in the health sector,
right,
both in private and also public sector. You talk of nurses, you talk of clinical officers, talk of medical engineers who maintain the equipments that are available in our health sector.
Yeah.
You talk of laboratory technologists who do the diagnosis.
Yeah.
Because before a doctor really treats you, he needs or she needs to ensure that the right diagnosis has been done.
Right.
So when you look at this cadre, there we refer to them as the mid-level. Because what happens is that we have the medical doctors who are few in this country.
Right.
These are people who have gone through a degree in training in medicine. But we have nurses who take 3 years, the same with clinical officers who actually form the bulk of the people who take care of us when we are sick.
Right, right. Okay. That goes to show, by the way, that they are who literally are our contact point before even meeting the doctor.
Definitely. If you just enter a health facility, for instance, you enter the triage level.
Yeah.
And the first person who will be taking your temperature, your weight, is the nurse.
Right.
And that's the first contact. And those parameters being taken at that level will be used to ascertain what conditions that you may be have been exposed to. And that's what the doctor will use eventually to treat you.
Okay. Let's also welcome our audiences to just weigh in on our ongoing discussion. If you like, this is even a day to actually recognize those who are the middle-level health professionals at all our health facilities and for all the hard work that they do put in. And we even do have a question of the day for you. I'm going to ask my director to actually put that up on the screen if he can, because we really do want you to contribute and give us your thoughts. We've asked, what is the biggest challenge that the healthcare professionals face today, in your opinion? What is the biggest challenge the healthcare professionals face today? If you are a trainee or you are actually working as a health professional, please, why don't you let us know at K24 TV, yet again at those social media platforms. Our WhatsApp number is at the bottom of your screen. And of course, if you do have a question for Professor Kiptoo as well, why don't you send them in? Now, when we talk about the various courses offered at KMTC, Professor, what is actually the highest enrollment currently?
At the moment, we have 18 programs, or you can call them 18 departments, and we a total of 76 courses. That is both from certificate level, you talk of diploma and higher diploma. The highest courses that are in demand are nursing, and then followed by clinical medicine. We also have pharmacy.
Right.
Those are the top 3 with high demand.
right.
at the moment.
There's this perception, and I don't know where it actually came from, that, people who generally take up nursing are people who perhaps didn't do so well on their KCSE levels. And I don't know, it's a really poor perception, and it's probably one of those courses that you go for, by the way, if you haven't really decided on what to do. Why don't you clear the air on that, by the way, because I find it such a ridiculous way of looking at it.
I think, to be honest with you, it is really the way you put it, ridiculous, in the sense that you must pass the sciences.
Yeah.
You must do well in chemistry, biology, and those are the hard sciences that we know. And there is no way you can qualify to pursue nursing if you have not passed on those two key subjects.
Wow.
Biology and chemistry. And we take a minimum for you to come and join us at KMTC to pursue a diploma in nursing. Right. You must have attained a C and above. We even have people who are coming from the university who should have joined the universities with B minus, B plus, opting to join nursing profession. Right. Which I think it is a key profession, because these are the people who will take care of millions and millions of human beings who are ill. Yeah. You can imagine if you are having a terminal illness, who will be able to change your diapers and so on? It is the nurse. So you must understand the body, you must understand what that person requires. So the notion that it is people who have failed is out of question. Right. I think it's just a perception that people may think that, and it's a calling again. It is a calling, yes. It is a calling. So I don't think there's anybody who wakes up today and says, oh, I missed, I didn't have anything to do. Let me just go and do nothing. Yeah. It will never work. You seem to be quite passionate as an institution on partnering up with county governments. Why so, and what's all that about? I think we need to understand first, why do we partner with county governments? Health is devolved. Okay. Kenya Medical Training College is a national institution. Right. So we work closely. One is that all our trainees, because our training is 70% practicum, and we need the health facilities to train. And the health facilities fall under the county governments. Yeah. So there's no way we can train without the county governments. One, they support us in terms of practicum sites. Right. They support us in terms of people who will be able to supervise our students when they're in the practicum sites. They also support us in terms of putting up infrastructure. Right. Because if you look at currently, we are having 71 campuses across the country. Yeah. And some of these campuses have been brought up by the relationship between us and the county governments. So it's paramount that you have a good relationship. That we must have a paramount, not only just the county governments, the area members of parliament through the national CDF. They put a lot of contribution in terms of infrastructure development. Yeah. And that's why there's that joint effort for us to ensure that we have a cordial relationship. So before you embark on anything, you must first talk to the county government officials, get the area MP involved before you actually begin something on the ground. We look at what drives, what is the need. We need to ensure that we take training closer to the people. Okay. And that will ensure that we have the opportunity for all Kenyans to have an equal opportunity. You can imagine when KMTC were only 28 campuses. Yeah, how many people were crowding. Yeah. But now we have provided opportunities across the country. But the paramount thing is that we ensure that there is quality. Okay. Irrespective of the number of campuses we have. Well, the KMTC board just this February visited Ndalu Ward, Togaren constituency in Bungoma to assess a site for a new campus. And when we talk about campus expansion, Professor, this actually means more enrollment. It means more graduates coming out into the market. And, we're hoping that there will be full absorption, by the way, for these individuals in health facilities. But at the same time, what do we always see in our news cycles? This group of the middle level health professionals go through so much. There's just a ton of problems surrounding health professionals in this country. Where do you think the disconnect is, though? I don't think there's any disconnect. One is that I've mentioned earlier that the health services have been developed.
Yeah.
So the nurses or the people we train are actually being employed by the county governments.
Right.
If you look at the ratios, we have not even attained the ratios that is required globally, that is acceptable. We are still far. So the challenge is that we may not be having enough resources to actually employ the required numbers. So that when you visit a level 1 facility, kula mashinani, you must have medical officers who are able to take care of you at that level. And for us, as we expand and train, we provide opportunities to Kenyans who may not have gotten any opportunity to train. But I believe that you are better armed with knowledge and skills. We're not just looking at this country. Because the more you have knowledge, the more the opportunities will come. It is always better to be armed than not to be.
Right.
Because that gives you an opportunity when opportunities avail themselves. We are looking beyond this country in terms of employment. If you look at medical courses, there's a very high demand, not only in Kenya.
But
look at the East African community, look at Africa, look globally. Go to US, go to UK. If you go to US, go to Australia, you will find alumni of KMTC, be they nurses, be they clinical officers, who are actually taking care of the sick in those countries. Go to Botswana, go to South Africa, you'll still find alumni of KMTC, which I think we provide the opportunity, not just for the immediate employment, but for the future. And when we have this going up globally and working in those countries, we generate a lot of income. Because they plow back to this country. All right. Economically.
Can I ask you to hold that thought, because we actually do have a caller on the line. Let's hear what he has to say. Joshua from Kirinyaga is with us this morning. Joshua, good morning.
Morning, Shiko. Tunashukuru Mungu hapa mvua imenyesha kweli.
Aya, asante sana pia kwa kutupigia.
I'm loving the discussion.
Right.
And I must say this is one area that I may have some knowledge and information about. Allow me to correct our panelists. I don't know, sometimes I think in our country we've become accustomed to sometimes saying what is right, quote unquote, or what sometimes is politically correct, or what people would want to hear. For example, in every sphere of profession, you always hear people say that, it's because people have a calling. It's because people have a calling. I will tell you this. Most, if not majority of our professions in various industries are not there because they have a calling. And nothing is no exception. If you listen to our security senior officials in the security docket talking, you always hear them say that, our officers are there because it's a calling. They are there, they will wish. But we know what happens in this country, whereby you bribe your way to the forces, and we have information, and we know, even in the KMTC, sometimes people have to buy those letters at cost of 300,000, 400,000. And finally, as we talk about, I've heard him talk about the many mushrooming MPs. There are 65, I'm aware. And if you look at some of them that have come up in the last 4 days, 4 years, about 3 or 4 years. If you look at one like Odaya, and I'm aware he knows, Odaya, MTC, Gatundu MTC, Baraka, just to mention a few. What we are trying to satisfy is the political craving to have the quantities. But in terms of quality, the training is poor. You're getting nurses who are coming out, and they are not up to the task really. And it's too all over when you see when you rate and then try to judge their delivery in services. It is really wanting. So let us be honest. Give Kenyans the best.
Thank you, Joshua. Thank you. Okay, I hope you've kept that in mind. He's brought up some points that I'm going to engage you on. Let's take a look at what's up very quickly in far as this particular discussion is concerned. What documents do I require to apply for nursing? One of the frequently asked questions that have been coming in, Professor Kiptoo, is about application to KMTC for nursing. And so you've even already seen one text message that has come come in. So we'll talk about application process into KMTC for nursing in just a bit. You've touched slightly on that, but listen to what Joshua from Kirinyaga actually had to say if you were paying attention, talking about how expensive the courses are, you know, paying almost about 300,000 for courses perhaps at KMTC, and even talks about the quality of services as far as KMTC is concerned. Would you like to take that?
Thank you, Shika. What is very paramount to us is that, one, the courses are not expensive. This is a government training institution. And by the way, the fee per year is 80,700. For nursing, it's 3 years. Some are 2 years if it's a certificate course. So if you take 80 times 3, that gives you 240. So when somebody says it is over 300,000, and then I think it's from a misinformation. Two, the programs that we train are actually governed by regulatory bodies. There's the Nursing Council of Kenya, where our graduates will go and do an examination before they are registered, and they must meet and qualify. So first, we need to make sure that we have the right equipment. Before we start a program, and I want to use nursing as an example, is that we have the Nursing Council coming and inspecting our facilities to ensure that, one, we have the right lecturers, we have the right equipment, and we have the practicum sites with enough personnel to be able to look and train the graduates when they are in class and also when they are doing their practicums. When it comes to application, the application is online. And you can visit our website, you visit the student portal, and you can apply online. There is no human interface. If you are in Lodwar, you can even apply with the comfort of your phone, and you'll receive your letter through your phone.
To the closest institution to you.
Not necessarily even the institution. As long as you go, you log into our website. You'll be able to apply, follow the steps, which are very simple. Requiring you to upload the documents required. All
right. So it's an online process. I can still see another text message that has come in. Hello, I'm a 2018 class student with a C-. Can I qualify for a certificate course, Professor?
You will qualify for a certificate course with a C-. But when you go to the specifics, then you must meet the cluster subjects.
All right, so we hope we have answered your question. Keep them coming. You know, we talk about every institution having their challenges. Professor Cyprian Nyakundi, the very controversial blogger, actually managed to speak to students who have been through the Kenya Medical Training College and have undergone various frustrations, especially nurses. You know, some of them were telling him that diploma in nursing takes 3.5 years, but you may find taking yourself 4.5 years due to poor management of the institution. Would you like to address that point? Because there are some, like Joshua, who believe that their, you know, quality of services by KMTC has been compromised.
I can tell you that there is no compromise in terms of quality and delivery of our services. Somebody can take 3 years, can take 4 years, depending on the performance of that person. If you don't pass your examinations, what do you expect? You'll have to repeat. And those are some of the issues. But if you follow the curriculum as stipulated, you'll finish within the required time.
And you said earlier on that, by the way, you also do have a regulatory board that oversees, you know, these checks and balances as far as your training program is concerned. Going back even to your on-ground visit in Bungoma, you know, I really did follow that. And I did see one director, Frederick Wamakai, who noted that the shortage of healthcare professionals constrains not only the achievement of UHC, but also health-related sustainability or sustainable development goals. And he said that the shortage is especially dire in the rural areas due to concentration of such workers in urban areas. So you're seeing a flock of all these graduates moving to the urban areas, right, to find work. How do you think we're going to actually solve the situation of penetrating the rural areas, the marginalized areas?
I think there are a number of ways you can look into that. Of course, if you look, why do we have people being in Nairobi, not in Tongaren, not in Lodwar? Is virtue of social facilities that are available. The way we can do is that now that there's devolution in this country, and you can see there is a shift in terms of development within the counties. What we have done as KMTC is purposely to work closely with those marginalized communities. And we are working very closely with the First Lady of this country through Beyond Zero, where we are training specific people from those semi-arid counties, Lodwar, Kilifi, Marsabit, Mandera, so that they can go back and serve their communities. And for us to achieve UHC, if you look at UHC, it's not really rocket science. We need the basics. Of course, we are looking at prevention. Who can do prevention? We need those people at the community level. We need community health extension workers. We need community health assistants. And those are the people who will work at that level. And for those people to work at that level, they must understand the community where they are coming from, understand their needs. And that's why we are training people also at that level. And that will now change the trend.
Okay. All right. Taking a look at your feedback concerning our discussion as we talk about health training in this country, do you have any questions for the CEO of KMTC? I must agree with Professor. Things have changed. We got to online applications. Expansion is now taking new direction. Can we match the graduates to UHC? We've got Partilol Koge in Lodwar, which is where you're talking about. What do you have to say about that, Professor?
What is very important is that for us to be able to achieve universal health coverage, which is basically you want to access the services, affordable, and if you walk into a health facility, you must meet a health professional who will be able to attend to you. And with those numbers that we are training, like for instance, last year, in December, 5th of December, we graduated 12,621 in various cadres. And this will ensure that the service delivery is accessible, it is affordable, as long as we have that joint, seamless linkage from training to being employed. Because when you look at that, as a training institution, we don't really employ, we train. So there's another arm
that must come in. Okay. And when you look at, because we've talked a little bit about enrollment, when you compare perhaps your main campuses in the city versus what you're seeing in different areas, how is the uptake on people, you know, just coming to the institution and saying, I want to learn?
The uptake is very high. One is that if you are based in Lodwar campus or you are in Wajir campus, if you are doing nursing, the examinations are synchronized. It's the same curriculum, it's the same assessment that will be done, and that ensures that there is uniformity in terms of examination and in terms of quality. So it doesn't matter whether you train in Nairobi or you train in Lodwar or you train in Musambweni. You'll go through the same curriculum, through the same process, you'll be assessed, you will be examined again by the Nursing Council of Kenya, and you are registered. Okay.
All right. So let's take a look at another text message. Do we have it, Bwana Director, before we take a commercial break? I'm Douglas from Busia. Is there any possibility of part-time classes at KMTC? Douglas, for whatever reason, can't be there full-time. Is there something that can be tailored to his schedule?
What is happening is that we do have part-time classes which we are developing now. Of course, if you look again, when you look at medical training, it is hands-on. So when you look at part-time, it's not just like any humanities courses where you can actually do online. You must have 70% practicums. That gives a challenge in terms of, but what we're having is that for those people who have gone through our system, they have either a certificate or a diploma, and then they can even do higher diploma as part-time classes. Of course, the basics, you must have the basics first.
Right.
Yes.
Okay. All right. We are partnering up with the Kenya Medical Training College today to just understand about health training in Kenya and how these services are actually going to be contributing to one of the big 4 agendas, which is universal health coverage. When we get back, we'll be talking to Professor Moore about the welfare of health professionals in this country, getting his take also on such issues about emerging and re-emerging diseases like the coronavirus. How our health professionals, by the way, are training and getting prepared to deal with situations like this. There's definitely more to come right here on K24 this morning. Keep talking to us.